you to talk about the role of the Patients for Patient Safety Foundation. Maybe it's a good idea as an external evaluator. It's a good idea for P4PSF to get engaged. That's bringing in something as a new perspective, and I think we should certainly consider. Over to you, Nadira ma'am.
Thank you. Thank you once again, everybody. Good evening. Now, this is a new initiative. Actually, it's an extension of CAHO. CAHO has been, for 10 years now, I think, playing in the field of improving quality, increasing patient safety, decreasing errors, and training people for the NABH or the accreditation standards. But one of the things was, in spite of everybody's effort, error happens, as Prissy ma'am said. And why does it happen? Who reports it? This is a very important picture on the right. Okay, so what we are, many people have asked, what is P4PS? This is an opportunity for me to say what P4PS is. It is basically a patient-centric project initiative. And we are an organization that CAHO started, but now we are an independent trust. We took our independence primarily so that we are not aligned to any brand. And we are seen as impartial. But our objective remains the same. We want to improve outcomes. We want to reduce harm. We want to create awareness that harm occurs in itself. One fundamental difference. What does the slide on the right side say? There's an umbrella, there's a name, but what does it say at the bottom? My health, my responsibility. If it was a doctor's slide, what would it say? Your health, my responsibility. One simple word we change, your health, my responsibility versus my health, my responsibility. So doctors do that. They take responsibility for your health. But where are you? So the patient is missing. The patient is missing in their own care, in their own journey. And that's what we are approaching. That's what we are doing. We are creating, educating, engaging, and inviting people. Come, don't be afraid. Talk, speak, share, learn, participate. And this, we feel, will help to not only to have common decision-making, shared decisions, but ownership of the outcomes as well, in the good and the bad. And therefore, you will learn how to be good. So next slide. What we do is we have a website. We handhold through the patient journey, tracking. This is disease agnostic, from all the stages of starting till finish, till care, and maybe even post-care. We make awareness of rights and responsibilities. Our approach is through people asking us questions or telling us their experiences. And everything, therefore, the answers are aggregated and put in a resource center, which is planted in our website. Next, we also, not just the website, but we are actively reaching out to large communities, large populations, different languages, different states, through emailers, through WhatsApp, through messages, social media. We've just begun our campaigns, posters, simple infographics. People have a very short attention span. And all kinds of, like this is a webinar where we are present. So to me, this is a great opportunity. And all kinds of populations. It could be healthcare, it could be individuals, it could be companies, it could be corporates, it could be associations. Everybody is a patient at the end of the day. So that is why we are trying multiple mediums to reach multiple people. And that's our main core job. One of the things, therefore, as an initiative would be to start the PSC. Where do we fit in? We are not duplicating. I mentioned your health, my responsibility, my health, my responsibility. So while CAHO on the left side, if you see, there are two blue boxes. The healthcare community on the right side is the patient community. When I mean it's a generic word, it means family, caregivers, support groups, everybody, right? In all of us are there. CAHO looks after, guides, and trains the healthcare providers. We have taken it upon us to educate the patients. We are nobody to teach the healthcare people what they do, but we want to learn from them. So therefore, at the bottom, there is a two-way traffic. We want to learn from you, and then we want to educate the patients. That's our role. And collectively, therefore, where do we sit? Do we go individually? No, not possible. Do we go knocking on departments? No, not possible. So the PAC would be one round table, one common room, one drawing room, where we are invited with dignity, with respect, with credibility, and we present our own menu. We partake of your menu, and we come back and again do our jobs. So it's a two-way process. And to me, this is an excellent solution to a very complex, a very long desired action, but this is a very simple formula. So if anybody puts up a PSC, it would result in a two-way traffic, in a two-way advantage. That's what we want. We're basically supporting you with the ideas, issues, formation, manuals, training, selection. That's all. Actual work will be done by the hospitals. We are there to help them. Next time. So this was a graphical representation, but if I want to be a little more specific, how will therefore Patient Safety Foundation support that? In precise terms, we will help to make the manual. We will help to make the guidelines. We are not calling it compulsory, and we will help to modify it from time to time after really finding the feedback. Common issues. There are lots of issues which patients have. We would like to collect it through stories, through feedback, or just through anecdotal things. And we will present it to you for further action. Education, I think, is one of our key jobs. And we will continue to do this irrespective, and we need your help. We need your information. We need your best practices. The whole thing, if we could summarize in one basket, which is already there, but nobody uses it, is the rights and responsibilities. It is so common that it has become wallpaper. Nobody knows it. Even the educated friends, people who visit hospitals 10 times a year, even they don't know. So we want to bring awareness that yes, there is something called rights, but it's accompanied with responsibilities. And we will have multiple education. We will give you this material. Please share it with everybody else. Next one. Next slide. So while we are doing that, we have a very small request. Please populate, please socialize, please publicize that there is an organization which has started for the care, for the welfare, for the engagement of, by, and for patients, if I would put it that way. It's of the patients, by the patients, for the patients. And publicize it on your front desk, on your television screens, on your handouts, on your discharge summaries, when they check in, when they check out, in the billing counters, anywhere and everywhere. In the pharmacy, just put a slip in. So our material is available. We do not charge. It is a free of charge completely. We do not take sponsorships. We are not aligned, and we are not soliciting anybody. No money solicited. So our posters, our materials, you can see it on our website, and we will give the content. You give us the best practices. We will transfer it into a patient-centric language, translate it into a regional language, and you distribute it for us. So there is something in it for everybody. We just request that you broadcast it for us, you publicize it for us. We'll do the hard work, you do the front work. Thank you. That's what we want to do. Thank you, Dr. Lallu.
Thank you. Thank you so much, Nadira ma'am. And this is certainly going to be a great initiative. I'm sure the entire healthcare fraternity will agree with me. And it's time for our